Welcome to our first Facebook Live of 2021. My name is Alexis Davis, and I'm the social media manager here at RSDSA. I am joined by RSDSA's wonderful advocacy committee, which is made up of Jeri Krassner, who's also RSDSA Special Events Coordinator, Jim Doulgeris, Nancy Shurtleff, and our committee advisor, Marni Cartelli. And here's a little bit about each of them. So for Jim Doulgeris, since retiring after 35 years in CEO roles for healthcare providers from hospitals to accountable care organizations, Jim is applying his extensive healthcare industry, scientific, and medical knowledge on advising healthcare companies as a member of corporate and advisory boards. Having been a popular speaker on healthcare subjects from population health to using healthcare analytics, he is also widely published, interviewed, and an advisor to 2 U.S. House of Representatives members as a thought leader on healthcare issues. Welcome, Jim. Next, we have
That just means I'm a loudmouth.
no problem. Next, we have Nancy Shurtleff. Nancy is a CRPS warrior and one of 6 women who arranged and presented at RSDSA's educational conference, Treating the Whole Person, Optimizing Wellness La Jolla in 2016. She also spoke at our Treating the Whole Person, Optimizing Wellness San Jose conference in 2018. Nancy is also on the board of directors for the Women's Club of Laguna Beach and is the director of community outreach. Welcome, Nancy. And we also have Marni Cartelli. Marni worked in the medical profession until an injury on the job led to CRPS. She came to realize that thanks in large part to her connection to the medical field, she received exceptional and timely care when many others of her condition did not. It has now become her goal to help minimize the disparities members of the disabled community experience in both access and quality of medical services. She is currently a board member of the not-for-profit Danny's Dose and has been member of the Global Genes Foundation Alliance Leadership Council for the past 3 years. Now, please remember that while the information shared here tonight is helpful, our guests are here to discuss developing relationships with representatives as well as policy issues. Please consult your physician for personalized medical advice and other professionals if you have an incident-specific situation. Now, usually I would turn this over to Jim Roach for a few announcements, so I'm going to try to take over these announcements right now. We have an amazing auction that's kicking off here at RSDSA on February 1st. Jeri, of course, will be sending out additional information about the auction via our newsletter, and we will share it on social media in the coming days and weeks, so keep an eye out for that. And we are also planning all of our amazing Facebook Lives for the rest of 2021. So if you have ideas, you have suggestions, please comment them or leave them in the comments, send us a message. We definitely want to hear from you. And now if you have any questions tonight, please be sure to leave your questions in the comments. We will be going over questions at the end of the session. Is there anything else I should cover before I pass it over to you all? That's good. All righty, well, I will leave it to you, experts.
Well, thank you. I guess it starts with me. If you want to put up the slide, Alexis, we can just at least have something to look at here, rather than me on the beach in Florida. Look, I'm just going to talk to everybody. I have CRPS. I think most of us do. This is, it's a difficult disease. It can make you feel isolated, alone, you can feel powerless. There's a lot of things that go along with it. And advocacy, which is really just kind of standing up for yourself, offers an opportunity to take control of your life and your future. And that's for your story and our lives and futures together. The way I look at it is it's kind of like taking victims to victors. And this is a part of a process. But we all face challenges, not only with the disease, but with insurance companies, with medications, with doctors, with all kinds of things, with our families. And our job as an advocacy committee is to equip, enable, and empower you. Our job is to listen to you and to act on a collective behalf, and to develop, recommend, and promote legislation, treatments, and most importantly, equal insurance coverage. And we did a survey, and those were all the #1 things. And I think we all face them. Now, there's a lot of ways we can take care of our future and take charge of it, but we're going to be most effective if we're all speaking with one voice. And, looking at our priorities, new treatments, new medications, equal insurance coverage, we can develop, we can promote, and we can enable as we go through this path. And we're going to go a very specific way to promote and enable research, development, and getting off-label drugs to on-label. I know there's going to be a lot of questions about these things, and we're not going to have solutions tonight, but we're going to have a pathway to get them. And when you look at change and when you look at advocacy, the best way to create change is to start with asking for help, to tell your story, to know what you want, and then just to simply ask for it. It's very, very powerful if you just talk to someone and ask for help. And it's also very powerful to be concise, be brief. And I always have a saying, it's brilliant are the brief, for they shall make their point. It's like a mantra. Can we go to the second slide, please? Okay, this is just kind of keeping it simple. First steps that you're going to have are for everyone to learn how to contact and identify their state representatives. You can Google them, and some you can email directly, some you can contact through their official websites, some you can call their local offices, you can call their Washington offices. You can ask for a meeting, and they're all gotten very good at having Zoom meetings now. And you can do that to introduce yourself, tell your brief story, and we have a couple of asks. One is for the advocacy committee, and the first thing to do is introduce yourself to your representatives and encourage them to join the Rare Disease Caucus. And that is a group of legislators who focus on rare disease issues and items. And that's how they get into legislation, and working as a team and working as a group within the legislature. That's how laws can get made that are going to be beneficial to us. And there's a lot of things that we're going to want to have done. And for your own personal issues, ask for specific help, but keep it to government agencies. Your representatives cannot influence an insurance company or a pharmaceutical company or a doctor or a hospital, but they can contact and ask questions of government agencies in their oversight capacity. And coming soon, it's going to be how to work with healthcare providers and insurers. And I know there's a lot of people who will be interested in that end of it. So with that overview, I'm going to turn this over to Marni, who is the real expert on advocacy.
Well, actually, Nancy's going to take over next, because what she's going to do, Nancy's going to teach you how to do what's really important in advocacy, which is what we call the elevator pitch. When you're talking to your representative, what it is that you're going to be speaking, what Jim was talking about, that brief message that you're going to say. So Nancy, please go ahead.
Thank you, Marni. Well, I was diagnosed in 2011 after a knee replacement. And as we all know, having a rare disease is hard enough, but when you have an invisible rare disease, it can be very isolating. So my journey with advocacy began with wanting to get over some of the obstacles that I was facing, the pain, the medications, the insurance coverage, all the unknowns. So I had read about Color the World Orange and how people were asking for proclamations declaring a day of RSD or CRPS awareness. And so that's where I began. I asked my city council to declare a day in November as CRPS Awareness Day, and they agreed on my first request, and it made me have a sense of empowerment. So that led me over to RSDSA, and I attended several of their conferences and had the opportunity to meet with other people who were on the same journey. Last year, I joined up with a nonprofit called Rare Disease Legislative Advocates, RDLA. And RDLA is a program of the Every Life Foundation for Rare Diseases. It supports the advocacy of all rare disease patients and organizations. So I registered for one of their training webinars and knew I could not only advocate for awareness, but that I could ask my representatives for support and some specific requests. So RDLA provided an amazing array of tools and suggestions. If you look at their website, the tools and kits that they provide are just amazing and very easy to follow. So last August, I had my first meeting with my California representative, Katie Porter. Because of COVID, it was telephonic. And my ask was that she join the Rare Disease Caucus, which is a bipartisan congressional caucus open to all members of the US Senate and House. And during my phone call, which was only 10 minutes, she agreed on the spot to join the Rare Disease Caucus. And within a week, she did join. So with that success, I saw that this type of advocacy is a real way to accomplish a goal, especially if you speak as one voice. If you can combine and ask for something in particular as a group, like joining the Rare Disease Caucus. So every year, the rare disease community hosts a legislative week in Washington, D.C. This year, it's going to be July 19th through 22nd. And during that week, individuals and groups are welcome to request times to speak to our representatives. RDLA will help schedule appointments for you. The meetings are very quick and fast-paced and often held in a hallway. So as Marni mentioned, it's kind of a quick elevator pitch. You need to have your thoughts together, have your ask ready, and just don't be discouraged. Sometimes you have to talk to an aide. You don't necessarily talk directly to the representative, but even if it's an aide, that person has the ears of your representatives. So just do the best you can, present your ask. And again, RDLA's website provides information, training webinars. It's all free. RSDSA can provide information and links on their website as well. And I encourage any of you who are interested to consider joining that. As you probably know, we have over 60 new representatives in the House. And so this is a great time to find out who your representatives are and approach them, whether it be in a phone call, a letter, however you choose, and ask them to join the Rare Disease Caucus. Give them a little bit of your background and then do a quick ask for whatever it is that's important to you. And with that, I'm going to leave it over to Marni to explain a little more.
Thanks, Nancy. One thing I really want to stress what Nancy said about speaking with legislative aides. I have been active now in advocacy, probably going on 4 years. And for the past 4 years, I've visited with my representative's office, I'd say 3 times a year, twice in DC every year and once locally. I have never actually met my representative, always one of her aides. And I have an amazing working relationship with that office. So don't ever get discouraged if you are with a legislative aide. It is not a slight against you. It is not a bad thing. The truth of the matter is a lot of the work that gets done in these congressional offices is actually done by the legislative aides. So what Nancy said is very, very true. Don't ever get discouraged by working with legislative aides. I don't know if I'll ever meet my representative, and I'm okay with that because we're doing a lot of work through her aides. And that brings me to the topic that I'm going to focus on, which is maintaining relationships with congressional offices and legislative offices, not just congressional offices, which I'm actually really excited to talk about because it's one of the easiest and most rewarding, yet most frustrating and hardest things to do. That's a lot to unpack, I know. But the truth of the matter is it's really easy to do the steps to maintain a relationship, but it can be very frustrating because sometimes you don't hear back from offices and you think that means that nothing's happening. But the truth of the matter is it's very much hurry up and wait. Let me give you a real world example. My first year of advocating. Just like Nancy, I literally Googled, how do I advocate for a rare disease? And what popped up first was RDLA. And I went down to DC as a part of the Rare Disease Week and met with representatives. And one of my asks was to join the Rare Disease Caucus. And my second ask was to sign on to a bill at the time that was called the Open Act, which is about repurposing drugs to get off-label drugs on label. And I talked to my representative about that. And there were my representative's office said in the meeting that they believed that they said that they were going to sign on to the Rare Disease Caucus, that was not a problem, but there were issues that they wanted answers to about the Open Act that obviously in the meeting, I didn't have the answers to. And I said, I will absolutely get you answers to those questions. And I did. I followed up with an email with answers to those questions, reiterating in the email all the salient points of why this was a great bill, why it was relevant to, in our case, CRPS and the rare disease community, and nothing. I set a reminder in my phone for a month later after that email to follow up. I followed up, nothing. Then a month later, sent another email following up, just again, reiterating the salient points about that bill, why it was important, but acknowledging, I know how busy your office is. It was a very pleasant, upbeat email, never a negative email. And I received a message back. It was actually an apologetic email, just not that it had fallen to the wayside, that they absolutely were planning on co-sponsoring, that they just hadn't gotten a chance to, and they were very apologetic that they hadn't gotten back to me. So it was a very rewarding experience because I did get everything I had asked for. It just took a long time for that to happen. So it didn't happen as quickly as Nancy's experience was, but it was still the same result. So it really is a wonderful experience in many ways. Now, there have been over the years things I've asked for that I couldn't get, but it didn't diminish the relationship between myself and the office. And a key to continuing this relationship is the fact that I regularly am in touch with the relationship, even if there isn't anything I'm asking for. And the truth of the matter is I do often contact the office and let them know about things that they've done that I approve of. If there's something that the office, that my representative has signed on to that I'm happy about, I let them know, because, you know, there was something that one of the Speaker of the House from Alabama, their House of Representatives, said on a call that RDLA had put together the other day. He said, oftentimes we only hear from our constituents when they're unhappy. It's nice to hear from them when they are happy. And it made me chuckle, because that's something that I ascribe to too. I like to make sure that I'm letting them know when I'm unhappy about things and also when I'm happy about things. And that's just how you continue to build a rapport with your representative. Another thing that I really, it's a motto that I live by, is that our reputation and our credibility is everything. So do not give out information that you have not verified. Sometimes it's impulsive when they're asking you questions about a piece of legislation or a policy, that you think you've heard something and you want to give a knee-jerk reaction or an answer in a meeting. There is nothing wrong with saying, I don't have that information on me. I will get that I will get back to you with the proper information. They expect that. You can follow up with an email. You can follow up with the proper information. You're not going to lose ground, because I can almost guarantee you 90% of the time you're not going to get a guaranteed sign on from somebody in the meeting that you're in. Most of the time, the work that's going to be done is going to be going in back and forth, you know, in several meetings over emails, or several meetings you're going to meet up with them later on. So in my opinion, one of the worst things you can do is give out wrong information, because they are taking notes. Whoever you're meeting with is sitting there and taking notes on what you're saying. And if you give out wrong information or you lie, even unintentionally, it can be really caustic to you, to the cause, and to your credibility going forward. And for me, that is something that's really important to me as an advocate, and that's my reputation and that's my credibility. So there's nothing wrong with, even if they're giving you information that you know is false, you can say, I don't believe that's accurate, but let me look it up. And when you address them later on in an email saying, referring to the information that you had, this is what I have. I'm trying to think. I know there's a lot of, this disease takes a lot from us. It took my career. You know, I got injured on the job. It can steal your identity. As an advocate, I feel like it's given me a part of myself back. It's allowed me to take a little bit of control back. And there's a lot of reasons out there, I know there is, for all of us to get discouraged. But there's a lot of hope too. I know it's easy for us to say that nobody cares. But I don't believe that. I do believe in people. Leave the politics, honestly, at the door. Whatever you hear, whatever you think, don't walk into your meetings with an assumption about the person you're meeting with. These are still people. They still have families. Whatever the rhetoric that's going on, don't bring the politics into your meetings. Bring your story. Bring what's happening to you, and bring whatever is going on into it. It's hard, I know that. But it has to be done. And you'd be surprised who's open to listening and open to helping. I've had representatives who I never in a million years thought would be empathetic towards what's going on in our communities, be open to helping our community. And I've had representatives who I thought would be so willing to jump in and help us say, there's no way I'm ever gonna help. You know, so try to leave any idea you think you have at the door. In terms of working on getting your elevator pitch down, Nancy's right. You're lucky if you're going to get 5 minutes, because if you go down in a group, like let's say with RDLA, it's not going to just be a group of CRPS patients. You're going to have a group usually broken up by district or by state. So everybody's going to be trying to get their asks in, but that's also okay, because in your follow-up is a chance to talk more about your story. It's a chance to develop that connection even further with the office. For example, my member's office always sends me, whenever we're talking back and forth, if it's football season, there's always a comment in there about the Giants. They know me well enough to know I'm a huge football fan and I'm a huge Giants fan. I mean, this just comes over time. It comes with developing that relationship. So I really just want to stress that I am just like every single one of you. I started out just as a patient who was lost, angry, scared, desperate. I didn't know what to do. And literally, like I said, I Googled. I just one day got to the end of my rope and Googled what to do. And we're here for you. The community is here for you. You do not have to be somebody with 1 million initials after your name to make a difference, or with an organization in order to get in with a representative. One person has a voice and has a story, and your story matters. You matter. So go out, and if you want to make a difference, make that difference, because I guarantee you will. We're all so different, and in that difference is absolute beauty. And I'm always here. If you ever need something, please feel free to reach out.
Something to keep in mind. You always have to begin, and I like to begin with baby steps, and the simple task and the simple ask is how you get action. And let the politics, and Marni's right, let the politics aside. A lot of what you hear is ginned up by the press, and the people you meet, as opposed to the people you hear about, are very different from the way they're depicted. They're not intimidating. They're people, and they want to help. They're in public service to serve, not to forward, most of them, some ideology that's going to be toxic or damaging. They're really trying to help. So what we're suggesting is to start with a simple thing. Identify your rep. Find out how to contact them, and then contact them with a simple message. Make an introduction. Tell your story briefly, and encourage them to join the Rare Disease Caucus. The more representatives that are in that caucus, the bigger voice they're going to have. And when they have that big voice, then we can start asking for important things and have the clout behind it to get them done. And that's what we'll do a lot as a committee, but just getting those simple things done. Identify, contact, tell your brief story, and ask them to join the Rare Disease Caucus. And that's going to be a great start, and I think you're going to find that to be very empowering. We'll have a story. A year and a half ago, well, 2 years ago, I was running a big organization. My condition was never diagnosed, and I'm in the healthcare business surrounded by doctors. It became acute. I had to retire. I thought I was heading for a nursing home. And 2 years of hard work and a lot of experimentation has me back. And the best therapy I have is to do things like this, to keep occupied and to find things that are empowering. And this is definitely one of them. So I think we're all very passionate about this.
Can I jump in here for a minute to tell you?
Yes.
So everybody, I'm just going to follow up with telling you that for your elevator pitch or for your first time, if you're writing the email or letter, we're the advocacy committee. We have samples for you that you can use. So you would look at our sample and then you can edit it and fix it so that it fits your story. But it's so you don't have to look at a blank page and go, oh my goodness, where do I start? So we have that for you. We have an email address. It's advocacy, if Alexis will put it up in the chat, at rsds.org, so that if you can't find your representative, although we have posted the link to finding your representative, just email us and we'll tell you who your representative is. Sometimes you don't even, they do have offices in your area. They have local offices, and I know right now we're not doing any visiting, but you can also contact them at their local office. And that's often a more one-on-one type of experience. But as I said, we're here and we have these tools, and we have these letters, so that when you go to your first meeting or when you first meet and greet, we can help you get that done.
I bet there's a lot of questions.
Alrighty, so I have been keeping an eye on the chat, and we've definitely had some questions about how to find your representative. And I know Jeri just spoke on that a little bit. You can definitely go to house.gov in order to put your zip code in and learn more about who your representative is and how to contact them. And I'm definitely loving all the tips that you all are providing about sending an email to your representative and calling your representative. I know someone in the chat just mentioned that we have an email template that we sent out. Feels like a long time ago, but I feel like it was recent. We sent it out in Q4. We'll definitely send it out again, that they have been using in order to, reach out to their representative in order to get a response and, just to speak to them. And trying to see if there are any other questions.
Well, you can look for us. Soon we're going to have a space on the website under advocacy where we can have these links posted and have a link to the sample letter.
Definitely. And I also saw that Sharon mentioned that during our young adult weekends, one of the activities that the young adults participate in is like creating and establishing their elevator pitch. And I definitely think that is something that is really helpful for anyone, CRPS warriors, anyway, anytime you really want to, get the attention of someone, definitely having an elevator pitch. And just like Marni was saying, making sure that it's concise and that you're, explaining yourself and, getting your point across, but making sure that you're leaving politics out of it, but, getting right to the point. And I don't know if there's any other tips that any of you can provide when it comes to creating an elevator pitch as well.
Yeah, I think the thing with an elevator pitch, and I think this is a great thing, and the elevator pitch will change as you evolve as an advocate. So don't ever worry that you have to perfect your elevator pitch on the first go. My elevator pitch what it was in the beginning, it isn't the same as it is now. And it also changes based on what I'm asking for, because there's different aspects to my story. There's that I need to get certain treatments that are off label, but there's also that, about when I'm discussing opioid therapy, or there's different ones, when you're having meetings, you can't always cram everything you want to in one meeting because there's just not enough time in a meeting. So, it will depend on what it is I'm going in for a meeting on which pitch per se that I'm using. But that'll come with experience. And that's something I really do. I don't want anyone in the audience to think that I need to be an expert at anything right away. Because I promise you, I have stumbled more times as an advocate than you could ever imagine. I mean, I could fill up a whole hour with the embarrassing stories that I've done as an advocate, and it's okay, because we're people, and you know what, our representatives are people, and the people that you will meet in the rare disease community and the CRPS community and the advocacy world, they all started at some point. So please don't let the fear of not doing something right stop you from trying, but be humble when you start, and know that be willing to admit when you don't know something. And that is the quickest way to learn and to have people reach out and raise you up.
Most powerful opening, I need your help.
Yes.
Yes, and
Definitely. And Jeri, I know usually we are tag teaming the comments during these lives. Have you seen any other questions or anything that we can touch on before we wrap up?
no, not particular questions. I did see a number of people are interested, and I do hope that you'll get in touch with us and let us know, because this is something, I mean, it would be so great if we put together, we're the advocacy committee, but we're interested in putting together a group, and that we'll work together, and there'll be times over the year where it's either Rare Disease Week or CRPS Awareness Month, in which that is a great time to follow up and to do your pitches. Not only are you advocating for the issues important, but you're also raising awareness. Every single person you tell is one more person, and this makes, the old metaphor with the rings in the water, and they spread out and they spread out and they spread out. And so that more and more people, because that's the other thing, we are interested in raising awareness. And so please, I hope we've reached people that they are interested in joining and advocating with us.
Definitely.
Participate, raise your hand.
I know, I feel like that. It's like, raise your hand for advocacy. And we did, thank you for those people who filled out the survey to tell us the issues and what's the most important to you, because we're starting with the simple ask of join the Rare Disease Caucus, but then we will continue, once you have your meet and greet, continue with coming up with talking points for the issues that are important to you, that you can go and see your rep and you will have your talking points with you, so you will know how to get your message across.
Oh, and if I can, just a message to everyone that's out there that's thinking about advocacy, and something that the best advice I've ever been given was by a rare leader. Her name is Andra Stratton, and she's been my mentor since I was ever in advocacy. And it was, find what excites you in advocacy, because advocacy has so many different dimensions to it. As you get involved, you'll learn there's mental health sides, there's policy, there's all different types. There's drug development. Find something in advocacy that excites you, that lights you up, that makes your eyes sparkle. And that is going to be what you pursue, because then advocacy is going to become more than just something you do because you want to do it or because it distracts you from the pain. It's going to become a passion, and it's going to become something that opens up worlds to you. And I promise you that. So that is my piece of advice, is you don't need anybody other than yourself and your passion, and you'll see, you'll change worlds.
Great advice.
Definitely couldn't agree more. Well, I definitely want to go over to the last slide because I know Marni sent over these amazing photos of some books. Did you want to talk about these books really quickly before we wrap up?
Sure. So one of the organizations I'm involved with is Global Genes, and they have these phenomenal toolkits. They have a lot more than just the ones that I have here. However, I have a ridiculous amount of these 3 books sitting in my garage, because I had these at the walk a couple years ago, and I had a whole bunch of them and nobody took any of them. So if anybody is interested in copies of these 3 books, let us know through the email and we will get them mailed out to you. Just let us know, because I would love to free up some space, and they're very, very useful books, and I'm happy to give them to the community. So just let us know.
Definitely. So if there's anyone who's listening and maybe can't see the screen right now, the 3 books, they are Navigating Health Insurance, Building Relationships with Your Representatives, and From Molecules to Medicine, How Are New Drugs and Therapies Developed. And if you send us an email at advocacy@rsds.org, Marni will definitely get those over to you. So definitely send us a message, or like I just said, send us an email, because I see there are a few questions about that as well in the chat. But I think that is all that we have. Any last minute thoughts, anything that's come up in the last couple of seconds that you all want to add before we wrap up?
No, I think we said what we're going to say.
Yeah.
Sounds good. Well, of course, thank you all for this great information. As always, we will have this video pinned to the top of our Facebook timeline for easy access if you want to rewatch it. And we will also add this to our YouTube channel. We will add the links that we have presented in the presentation to the RSDSA website as well. So once again, if you have any questions for us, if you need a support group, or if you're looking for a new physician, or if you want to tell your story on the RSDSA blog, because we are always looking to tell stories of other warriors, please send us an email at info@rsds.org. Thank you all and have a great evening.
Thank you.
Good night, everyone.
Night.
Yeah.